The GALILEI is a very robust system merging placebo with a dual shine fluid technology. It's pretty robust, it's very accurate in my measurements, and most importantly now with the thickness progression profile, it made me something that most other tomographers don't. A very early peek into keratoconic patients and into patients with early ectasia. I use the GALILEI both diagnostically and surgically. Diagnostically to decide whether a patient is good to go for a refractive surgery, but surgically to plan a corneal ring segment planning and to plan other surgery from phaco on the Z8 or LASIK as well. For the corneal ring segment, it gives me an excellent surgical decision planning where to put the ring, where is the best meridian to place my incision at. What I use more importantly is actually the higher order aberration given by the GALILEI. I think the GALILEI is one of the few devices that would allow corneal higher order aberrations both on the Purkinje and on the pupil or anywhere else on the cornea. And it gives you a total corneal wavefront aberration and not only an anterior one. That's vital for me when I plan my corneal ring segments insertion. The thickness progression reports on the GALILEI is the difference in pachymetry towards the periphery between any point and the thinnest point of the cornea. Now, it consists of 3 graphs, X and Y, and 4 maps and a couple of indices. But why we should have it? Because I think it's one of the earliest signs of corneal ectasia. And for a refractive surgeon, it would be ideal to have that. What I like in the thickness progression profile on the GALILEI is that instead of the usual traditional way of looking at comparative maps, it goes one way further. It shows the change in pachymetry, like the differential of pachymetry relative to the thinnest point at every single point in the cornea. And that's very important, that instead of averaging the different points at every distance from the thinnest point, like we see in most maps and most tomographer, it shows you the instantaneous change at every single point in the cornea. So you can tell if one point infranasal is much faster in progression than another point supero-temporal, and the other way around. And this is actually, it gives you a focal change, and that's the earliest change in keratoconic patients. So this is my go-to in any patients seeking refractive surgery or any patients post-refractive surgery. I look at the maps in general, but this is the one that seals the deal for me. The one that I'm pretty sure if a patient is normal, abnormal, good to go, or not to do.